Hey guys, how you doing today? We're going to jump into chapter 2, exploring health careers. This is one of my favorite units. This will get you guys rolling into a thought process of what you guys want to do as sophomores, juniors, seniors. Many of you guys have already put a lot of thought into what you guys want to do, who you guys want to be, and kind of where you're moving, what direction you're moving um, into your into your career, next phase of your life. Um, what personal traits or characteristics might help you be successful as a healthcare worker? Some of these things that we've already talked about. That's all we're looking for here is concern for others, also known as empathy, or strong work ethic, something that's going to stand out, good communication skills, the five C's, strong interest in sciences. That always helps as well. Planning for a career in healthcare. If you want to be in a healthcare career field, there's many different routes to take there. By being in this class alone, you've already taken that first step. You've already said, I'm in, I want to do something in the health field. I'm not sure what I want to do yet. I know absolutely what I want to do. Or you could be kind of on the fence between a couple careers, and this unit is really going to help you understand where you fit in. If you plan to work in the healthcare, you need to choose a specific career to pursue. Some self assessments can help, kind of what your personality type is, how that relates to different careers. Finding a career that matches your interests and abilities is important as well. Not everybody can be a doctor. Not everybody can be a nurse. Not everybody can be here or there or whatever. Not everybody can be a surgeon. Some people want to get a little queasy. They can't handle blood. Maybe those people will be better serving others in different support elements. So just know kind of that there's different routes to take. What are three questions you can ask yourself as part of a career self assessment? Something like, do you like being with people of all ages? Do you consider yourself successful as a communicator? Do you enjoy solving problems? Some things you could also think of, do you want a 9 to 5 job? Not a lot of careers in the healthcare career field or in the healthcare field are 9 to 5. Doctors, when I was working in the hospital, a doctor worked 24 hours on. They would sleep sometimes at the hospital. They pull a double shift. They worked really until the work was done. My wife works with the doctor, and that doctor is an oncologist, which is specializing in cancers. Her specialty is breast cancer, and she makes her rounds in the morning and at night. So she'll go to the hospital at 6:30 in the morning, be there until about 8:30, come to the clinic, work clinic all day from 8:30 to about 6. After that, she'd go back to the hospital, do nighttime rounds with her patients that are in the hospital, and then she will go home and she'll work all night. My wife will get emails from her physician at 2, 3 in the morning about patient notes. So give that some thought. What kind of job do you want? What kind of career do you want? What kind of family life do you want? That all goes into what kind of career you want to seek. Job shadowing, clinical internships. These are all ways that you can get an idea of what it is to be a healthcare professional, what those jobs are really like. It's always good to ask questions before you dive into a 10-year route or 10-year commitment in school to be a doctor. You should decide what kind of doctor you want to be and do that by shadowing. Because if you change your major or you change your specialty in med school, you could add on more years to your schooling, and if that derails your life plans, that could be a major setback. So just keep that in mind as well. Excuse me, talking a lot gets you all perched. Both techniques are allow you to gain hands-on experience though inside the healthcare facility. When you choose a career path, you need to consider some things. How much education are you willing to complete? What kind of salary do you want? What type of workplace environment do you prefer? Hospital? Do you want to be in a clinic? Do you want to be on an ambulance? Do you want to be um, in home care? There's many different types of care, so you need to understand that and what you want to do. What type of workplace environment would you prefer? Occupational Outlook Handbook, some things like that. Like, okay, if you look at being a nurse, there's a lot of different nursing specialties out there: pediatric, oncology, ICU, emergency, hospice, different types of nursing care that you could go into. It's important for you to understand that each one of those have different um, ways to understand. Sorry. Each one of those specialties have different routes to them and different work environments. So you need to understand that. Healthcare association journals, career counselor at school, they can help you. I can help you. Just ask questions and we can do research together. That was crazy that last little bit. I'm sorry, I lost my train of thought. I was thinking about something else and then something else crept in my mind and I was like, whoo. Anywho, back on to decision making, making an informed decision. Informed decision means you know the who, what, why, when, where, how of that career that you're choosing. And it's not just, I want to be a doctor because I want to make a lot of money. Okay, that's the wrong reason to go into careers. I want to be a nurse because my mom was a nurse. Okay, what is it about nursing that you like? What is it that you don't like? What are the pros? What are the cons? You need to ask yourself those things before you rush into careers. Don't do that. You may have to evaluate and modify a decision after making one, so be flexible with it, but also have two or three options in place. It's not easy to get into nursing school. It's not easy to get into med school. So you need to keep that in mind when you're applying to these. You may have to, you know, sacrifice a year in order to get into the school you want or the program you want, or apply yourself hard now so you can get into those programs when it comes time. Some educational requirements. This is the part where a lot of students struggle, especially in this class, in the health science class, because they don't understand fully what it means to have educational requirements for certain jobs. The amount of education needs varies for many different careers. Levels of education, such as high school, on the job training, technical school, community college, or 4-year college or universities. Those are the different routes you can take. A high school, obviously a high school diploma. You graduate from Timber Creek, boom, you can get a job doing something in the health field, maybe as a receptionist or a secretary. Those are all things that you could do on the job training, meaning that they will hire you with no experience but train you while you're doing it. Technical school. That means you go to a school specifically set up to teach you how to do a certain thing. Some technical schools out there are like radiology technicians, CNAs, LVNs, medical laboratory tech, medical equipment technicians. Those things go through technical schools most of the time. Community college, you could get an RN degree with 2-year community college degree. It's almost 3 years, but it's like 2.5 years. Um, it's like 2 years and one semester of schooling at a community college to get your RN. And that's a 2-year nursing degree. You can still work in a hospital as an RN under an RN license, but only go to a community college. Or you could go the what is considered, I guess, the traditional route, which is a 4-year college or university. Go there, you do your 4 years. Those are, for instance, TCU, North UNT, UT, Texas A&M, University of Houston. All those are 4-year colleges or universities. Community college would be like TCC. Technical school would be like Galen College of Nursing or uh, Career Point School. On the job training and things like that would be done through the employers specifically. Why is continuing education part of important for those in healthcare occupations? Some employers or government agencies require workers to take additional courses to maintain professional status. For my EMT license, I have to complete a specific amount of hours, 24 hours to be exact, over a 3-year span to keep my license relevant. If I don't do those hours, then I don't keep my license. If teaching, for my teaching certificate, I have to do a certain amount of hours every 5 years and reapply to get my teaching license recerted. If I don't do those hours, then I don't get my teaching license. So it's important that you're always getting those hours, continuing as you being a lifelong learner, and not just thinking that once I'm done with school, I'm done. It's not that easy. It's actually a little more difficult than that. So keep that in mind. In today's world, where changes and discoveries continually occur, it's important to continuing education to is critical to remain up to date. So an example of this would be with CPR. I still teach people CPR and they think ABCs: airway, breathing, circulation. But 3 years ago, they changed it to CAB: circulation, airway, breathing. And so people aren't continually staying up with their CPR, and they're like, oh, I took this 5 years ago. It's ABCs. ABCs. No, no, it's not ABCs anymore. It's CAB. They changed it. So you would know that if you stayed up to date on it. Or different things in your specialty may be changing, or research development is occurring, and they could be all kinds of changes to protocols and to ways that you handle things. And if you're not continuously learning, then you're not going to keep up to date with that information, and you could make a fatal mistake. The difference between licensure and certification. These are required for some careers. I have a teaching certificate. What does that mean? It's a certificate given for completing a course of study or passing an exam. I have a teaching certificate because I passed 2 exams to be a teacher. The state of Texas, SBEC, gives me, TEA, gives Teaching Education Agency, the Texas Education Agency, they give me a license, they give me a certificate saying that I passed exams, I can teach you kids in this content area. My EMT license is awarded to me by the state of Department of Safety, Texas Department of Safety, when I meet a qualification for a particular occupation. So as an EMT, I have an EMT license because the state of Texas says I met all these standards and qualifications. And so I got a license for that. My certificate is given for a course of study or passing an exam. So I got a certification because I passed an exam. So there's a difference between a licensure and a certification. Depending on which career you choose, you're going to have one of these things. You're going to have a certification. It may be voluntary or required, or you're going to have some sort of licensure to practice medicine. So just kind of keep that in mind. Licensure and certification, they're kind of like a Venn diagram. There's like a circle, and they kind of overlap with what they are, but just know that they're each important. Different type of health careers by pathways. There's 5 different pathways for health careers. Number 1, therapeutic services, and we're going to go deeper into these next slides. But therapeutic services, diagnostic services, health informatics services, support services, and biotechnology research and development. Those are the 5 different pathways for healthcare careers. You're going to go deeper into these and get examples of these in a second. With therapeutic services, you're looking at your traditional thought about health careers. Those careers are like nurse, physician or doctor, paramedic, dental hygienist, occupational therapist. Those are all therapeutic. That means that they offer rewarding hands-on careers that are focused on changing the health status of a patient. Meaning, I'm sick, I come to you as a therapeutic service, and I get better. You prescribe me medication, you give me some sort of advice. That's what I do. Or you take care of me while I'm sick. Those are therapeutic services. To become a nurse, you must obtain at least an associate's degree in nursing. A licensed practical nurse, LPN, or a licensed vocational nurse, an LVN, works underneath registered nurses. Advanced degrees will allow you to become a nurse administrator, manager, instructor, or nurse practitioner. Those are all different levels of nursing. Doctors, they require many years of college, medical school, and internships. Required education can take 10 to 15 years, depending on what your specialty is, and to prepare to become a doctor as early as possible, preferably right now in this class. If you want to be a doctor, you got to strap in, put your head down, and get to work for the long haul. Successful doctors often exhibit strong leadership skills as well. Dentists, obviously, they're in charge of cleaning your teeth, prevention, diagnosis, and treatment of diseases and disorders. Dental school is required after earning a bachelor's degree. So you go to your 4-year university, you get your degree, usually in pre-dentistry or chemistry or biology. And once you get that degree, then you can apply to dentist school. Once you get into dental school, you get your DDS, which is Doctors of Dental Surgery. Once you get your DDS, you become a licensed doctor, a licensed dentist, and you can practice dentistry within the state that you're licensed in. And usually dental school is another 4 years, so 8 to 10 years total to become a dentist. What is involved in a career as a veterinarian? You know, veterinarians are therapeutic services as well. They diagnosing, treating, or researching their medical conditions and diseases of animals. In their practice, veterinarians treat pets, livestock, animals found in zoos, racetracks, laboratories. Veterinary students are required to complete a 4-year of Doctor of Veterinary Medicine program after earning their bachelor's degrees. So they have, again, 4 years of bachelor's, 4 years of veterinary school, 8 total years. If you specialize in something, it could be 10 years of schooling. So if you graduate at 18, you wouldn't be working until you're 28 if you have no hiccups, no failing grades, no family emergencies, no year skip because you didn't get into the school you wanted, any of that. So really aim till 30. Licensure is also required to practice in this profession, so you have to have a license of veterinary medicine. Some other therapeutic services like respiratory care workers, physical therapists, occupational therapists, emergency medical technicians, paramedics, medical assistants, all therapeutic. Diagnostic services. Diagnostic service careers are ones that involve procedures to determine the cause of diseases, research usually. Some diagnostic services workers are often unseen by patients. They work in a lab, they work in an office, they offer a variety of jobs depending on your level of education. It just depends. Some of those are like the clinical laboratory, some careers like clinical laboratory technologists, clinical laboratory technicians, phlebotomists, which are blood draw. They draw blood when you go to the doctor, clinical laboratory aides, pathologists. Pathologists are the ones that study the cells and determine the cause of disease. All of them are clinical laboratory. Also, vision care. Due to the aging population, vision care becomes a growing industry in the coming years. Three categories of eye care professionals are ophthalmologists, optometrists, and opticians. Um, Opticians are the ones that, you know, size you for your glasses and check and see which prescription you need. Ophthalmologists, they're looking at surgery and the disease of the eyes. And then optometrists are just your normal eye doctors, the ones that look at it and find out what's going on with your eyes and diagnose any eye problems you have, things like that. Ophthalmologists and optometrists have the same qualifications and can treat the same conditions. That's false. Like I just said, ophthalmologists are medical doctors who specialize in vision care and eye diseases. They are licensed to diagnose and treat all eye problems. Optometrists complete 4 years of graduate education of a college of optometry. They examine patients for eye problems and fit eyeglasses and contact lenses. That's it. Radiology workers operate x-ray equipment to take pictures of internal parts of the body, must take appropriate safety measures. Some examples of them would be radiologists, radiation oncologists, nuclear medicine technologists, and diagnostic medical sonographers. Medical sonographers are the ones that look inside the body. Nuclear medicine and radiology or radiation oncologists, those are dealing with cancer. Nuclear medicine is like radiation treatments, things like that. Radiation treatments are also have to do with oncology. And radiologists, they're the ones that are your x-ray doctors, the ones that are looking at the x-ray saying, yes, that's the that's your uh, ulna, and it's fractured in two places with a this type of fracture or that type of fracture, whatever it is. Those are the ones that look that over. Health information services. This is the third one. These careers involve a study of managing health information. Health informatics services workers provide critical support to all other medical services like admitting department workers, health unit coordinators, medical record workers, billing and coding, all the informational stuff. Think about all the information that they get, patient records, personal information, all that. They manage all that information. Some careers that you could have in health informatics: medical clerical workers ensure that everyday operations of the healthcare organizations run smoothly and efficiently. Health information specialists record detailed patient information. If you're a diagnostic coding specialist, you maintain electronic health records, which the days of the old wall of records in an office are going away. Everything's going online. Health unit coordinators manage activities, schedule patients, and handle telephone calls. It's a very busy career, working nonstop, 8 hours a day, but it's not one that requires a lot of school. Medical clerks ensure that healthcare organizations run smoothly and efficiently. Would you prefer to be a medical clerical worker who deals directly with patients and their families, or one who does not see the patients? You know, that's another self-reflection question. You ask yourself, which one do I want to be? Do I want to deal with patients? Do I not want to deal with patients? Because these have both sides of that. Health informatics, you could be in the billing and coding department where you never deal with patients. You only look at records, assign codes, and send it to the insurance. Or you could be right up front as a secretary, and you could check them in every day, talk to them, ask them how they're doing, create those relationships. Some support services. These are the ones that are probably the most important, but the most overlooked as well in the healthcare industry. Things like housekeepers, services workers, food service workers, dietitians, grounds and building maintenance workers, biomedical technicians. These are all things that fall under support services. They're not directly related to the care of the patient or to the patients, but they help keep the things running. Housekeepers, they clean the room, keep the hospital clean, they keep it germ free. Excuse me, central service workers, those are the ones that you go to like informational booths and things like that in the hospital, talk to people, ask them where things are. Food service workers, they obviously make all the food. Dietitians make sure that every patient that are in the is that is in the hospital or in the facilities, long term care facilities, term care facilities, they make sure that their food's taken care of. Grounds and building maintenance workers make sure the buildings and the grounds look good, because if it looks good, people want to work there and people feel safe there. Biomedical technicians, they work with biomedical uh, instances. Like I said, housekeeping, one of the most overlooked um, jobs in the healthcare field, and housekeeping employees work continually to see that the facility is free from infectious agents. Is the most important one. It's bullet number 3. Food service workers are responsible for providing each patient with safe nutritional meals. Dietitians work with patients diagnosed with disorders that require a special diet, such as heart disease, which would mean you're on like a low sodium diet, which is low salt, so you don't build up fluid in your heart, things like that. What do you workers in the central services department or healthcare facility do? Well, they keep inventory of supplies and equipment. They play a key role in making sure patients are exposed to infectious diseases and help ensure that doctors and nurses have proper sterile equipment for procedures. Biomedical equipment technicians, they maintain, install, and repair a wide variety of healthcare technology and equipment. When you start thinking about the vast world of healthcare, you start thinking about all these careers that we've just went over, you start to realize that there's so many different parts to a hospital or to a clinic or to a long-term care facility or short-term care facility, that they don't just run on their own. They're not self-sufficient. They take a number of different careers in order to make it function properly. So that's just one thing to think about when you're thinking of what career you want to do. Is what is what is your personality type, what fits you, and then also on top of that, how does it help you or hinder you in the long haul of your life goals? Do you want to be one that's stressed out all the time? Do you want to work in a high stress environment, low stress environment? Do you want to be motivated every day and talk to patients and stay high and happy and cheerful? Or do you want to be in more of an introverted role where you maybe sit in an office, look at a computer, read things, or you're in a lab and you're doing research? Well, biotechnology research and development is a career pathway that can give you that option as well, where they work in laboratories instead of healthcare facilities. They work on a strong background in and love of science. So this could be like researchers finding cures for cancer, looking for ways to combat some diseases like Alzheimer's or ALS, all those different types of diseases that are out there that you always hear about. Some of those are like microbiologists should be able to effectively communicate their research progress and findings, and biological scientists study living organisms and may assist in the development of vaccines, medications, medicines, treatments for disease. These bioengineers have an engineering background, but they seek to improve medical devices and help develop new devices. They may also design or construct artificial organs or implants. These healthcare workers discover exciting solutions in medical challenges. So, what types of tasks do biological technicians or laboratory assistants perform? Pretty simple. Biological scientists and engineers study and perform experiments. They also help develop, manufacture, and test medications. Laboratory assistants maintain the equipment used in the laboratory. They may clean, store glassware, maintain inventory, reorder supplies, may test glassware to verify that it's free from contaminants, all that stuff. And so that kind of sums up in the big, large part careers. There's the 5 different types of pathways, and a majority of everything falls under therapeutic, but it's not the most important. I mean, without therapeutic support and biomedicine and diagnostic, they wouldn't be as relevant, but they're all equally as important. It takes people that want to be a house cleaner as much as it takes a doctor. Just everybody has a different agenda, everybody has a different educational level, everybody has a different ability level. Not everybody can be doctors, not everybody can be nurses, not everybody can be EMTs, not everybody has that ability to work with patients, but you can still be in the healthcare field. You don't have to just be in patient care. So think about it over the next couple of weeks as we do this unit, as we go through this unit. What are you? Who are you? We're going to do a self assessment, things like that. But notice that they all work together. It is equally as important as the other. One is equally as important as the other. So your therapeutic services jobs are just as important as your diagnostic, as just as important as your support, just as important as your health informatics, as your biomedical research. They're all working together in the same with the same idea in mind, and that is to care for people. And so that is the umbrella over all of health science is just care for people. If you care, if you can care about humans, if you care about our existence, then you'll fit in just fine in the world of healthcare. You just have to be able to work with others, communicate, and care about people. So, without further ado, I appreciate you guys listening. I hope these are helping you guys and hope you guys find them interesting. If you do miss or whatnot, they're a good, useful tool for that as well. Welcome to the Careers Unit.